Ahlan wa sahlan wa marhaban, assalamu alaikum wa rahmatullahi wa barakatuh, mtazamaji wa Ihsan TV, karibu sana ndani ya kipindi tiba Ijue Afya Yako, kipindi ambacho tunakuletea kila siku ya Jumamosi muda na wakati kama leo. Jina langu ni Maryam Juma, mtazamaji. Ndani ya kipindi kama hiki Ijue Afya Yako, mtazamaji, huwa niko na madaktari tofauti, na siku hii ya leo niko naye Dr.Mumtaz Mohammed. Yeye ni clinical neuropsychologist na vile pia ni psychotherapist na ni re-evaluation counselor. Na Dr. Mumtaz, mtazamaji, anatokana na kikundi cha CAMP, yani Kenya Association of Muslims Medical Professionals. Na siku hii ya leo inshallah tutakuwa ni wenye kuzungumzia kuhusiana na hawa watoto wetu ambao wenye maradhi ya autism. An Islamic psychological perspective on autism. Autism Kiswahili wao wanaita tawahudi, yani maradhi ya tawahudi ama autism, ama tunaita kwa Kiingereza pia ASD ama Autism Spectrum Disorder, mtazamaji. Kwa hiyo ikiwa una lolote kuhusiana na swala kama hili, basi unaweza kudondosha ujumbe wako katika live zetu zinazoendelea katika ukurasa wetu wa Facebook na vile pia katika ukurasa wetu wa YouTube, mtazamaji, na biidhnillahil karim daktari yupo kwa ajili yako. Jina langu ni Maryam Juma, mtazamaji. Hii ni Ihsan TV, unatupata live kupitia YouTube channel yetu Ihsan TV, na vile pia kupitia Facebook page yetu Ihsan TV, na vile pia mtazamaji unaweza kutupata kupitia Instagram, TikTok na Twitter ama X, jina ni Ihsan TV, na utapata mengi ya kuweza kufurahisha, mengi ya kuweza kujuza na mengi ya kuweza kukuburudisha. Kama kawaida mtazamaji, ndani ya kipindi Ijue Afya Yako huwa tunaelezana mengi machache kuhusiana na maradhi kadhaa, na siku hii ya leo kama alivyokuambia tunazungumziana kuhusiana na watoto hawa wetu wenye maradhi ya autism. Kulingana na mtazamo wa Kiislamu, lakini kulingana na Islamic psychological perspective. Kwa hivyo inshallah makinika na mimi, zidi kutazama, zidi kutegea Ihsan TV ili tuweze kufaidika pamoja. Na daktari wetu siku hii ya leo yupo hapa ili tuweze kujua mengi zaidi. Dr. Mumtaz, assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
You can just
take it nearby?
Yeah.
I can come near?
Okay? Yeah, it's okay. Okay. Maybe in brief.
Okay.
You can tell our viewers, who is Dr. Mumtaz?
Oh.
Okay.
Okay, that's the next question. It's very important for us to know with whom we are talking and with whom we are interacting.
Kabisa.
Okay, my name is Dr. Mumtaz Mohammed Shafi, and by profession I'm a clinical neuropsychologist.
Okay.
And even I have finished my basic certificate course currently in speech therapy too.
Okay, mashallah.
I think that's again was the requirement for our gifted children, ASD, like Autism Spectrum Disorder.
Okay.
So that's the one which had motivated me to learn this course again.
Mashallah.
Alhamdulillah. So I've done that. I'm into this field almost 20 years.
Oh.
Yes.
Okay.
And I'm practicing at Pandya Hospital. I do have my small organization at Nyali side. And inshallah, there is another one, CBO, which we are planning to open.
Inshallah.
We need everyone's dua so that this CBO can reach far and far, and we help more and more people.
Inshallah.
That's the main agenda.
Inshallah.
So I do deal with clinical neuropsychological cases, psychiatric. So you can say overall mental health well-being.
Yeah.
I deal with those kind of cases. Adolescents, youth, old age, dementia, Alzheimer, all those cases, children cases too. My main work is to diagnose the patients and at the same time doing therapies, because we work more on the therapies.
Okay.
And at the same time we have to coordinate with the psychiatrist, we have to coordinate with the other school experts, or any organization where the people need the help. So we work as a team. That's what we do it here.
Okay.
So that is my brief introduction.
Okay, thank you. To begin, what is autism? Or what is ASD? Okay.
Autism, or you can say Autism Spectrum Disorder. If we don't call autism is a wide, diverse. It's like a big spectrum disorder. It's basically in Islamically, there is no word is written. Autism spectrum disorder. If you will search or anywhere, you will not find anywhere written autism spectrum disorder.
True.
But of course, it's written neurodivergent.
Oh.
This is there in our deen also. It is there in our Quran. And of course, if the name is there, that means there is a solution also.
Obviously.
And even ASD or neurodivergent, if you know, like our Western culture and secular societies which we have here or all over the world, before they used to call autism, but now they have also moved to the word neurodivergent. And I heard from many of my colleagues in European countries, they label these children used to be stupid.
Yeah.
They don't have brain. They are useless.
Useless.
But they have come out from those things. Now they are calling them as a neurodivergent. So it's a big category. So when we say neurodivergent or children or adult, it's not only the neurodivergent or autism is always in the children. You will find adults also with those conditions.
Okay.
So it is a condition.
Yeah.
It's not a disease. Now what exactly happened in this condition? They have a challenge in communication skills. Let me repeat again. I'm saying communication skills.
Yeah.
That is one aspect where they have problem. They have a problem in social interaction. So whenever they have to get into society or playing a role or mingling with other people, they face challenges.
Okay.
Another one which we say, they have a lot of repetitive behaviors. When I'm saying repetitive, is like, you know, they like to flip their hand, they bang the table, or you will find them, they rock the chair like this. So those kind of a repetitive behavior you observe in these children. Last but not the least, another area where they are mainly affected is they are not able to connect with the society. So they are very much, what you call, sensitive to the sensory, like voice, eyesight. They are very sensitive with the sensory stimuli around them. That's why you find that when you take these children to a supermarket, they are not able to cooperate.
Okay.
Or if you take them to a place where there is a loud noise, they can't settle, they move around, they're very hyper, they're very restless. So these are the main features you will see in neurodivergent children or autism spectrum disorder.
Okay.
And then at the same time, autism spectrum is, the way I told, it's a spectrum.
Yeah.
So generally we say there are categories: mild, moderate, severe, profound. This is very important element. Okay? Like when we say mild category, or these children can function into the mainstream schools or into a normal society.
Normal. Okay.
And even moderate. So it's more about, like, you know, you need to understand the condition of these children, so that you know what to do, how to go about it. So this is more about autism spectrum disorder.
Okay. There are many misconceptions about autism. What are some of the most common myths you encounter?
Yeah, I think this is very interesting question. And I totally agree. There are a lot of myths which we have, and I think you must be aware of some of them.
Yeah.
Yes. So, like, as per me, before I go, what do you think? First, you tell me the one myth, if you remember.
One myth. Most of the people that have, or most of the community, whereby there is an autism child, they labeled the child as a curse.
I agree. Totally true.
Yeah, they label the child as a curse. Or if it's a family, the nuclear family is being abandoned because of the child.
That's also another myth. Mashallah, Maryam. I think you know a lot. And I think you have really helped me a lot by providing 2 myths already. So I agree with you. There is one big myth which is there, is like it's a curse.
Yeah.
Generally, I have come across many parents.
Okay.
Because, you know, when you sit at the clinic, you meet different people from different backgrounds. There are people who are Muslim, non-Muslim.
Yeah.
And you will find myths are common. There is no difference.
Yeah.
So you will find this one of the things which you said, curse.
Because I think we all think the same.
Exactly.
Because we are in we are in one culture. Yeah.
We all think the same. And that is why, you know, I said this myth is a big stigma in the society we still have. And people think, oh, it's a curse, they think, oh, you know what, you must have done something in your life before marriage, that's why you have a child like
this. Yeah,
and that gives the guilt feeling to the parents. That is
true. Yeah.
Or they say, you know what, the mother is like this, that is why this is happening. This is another thing.
Yeah,
there is a problem in the mother. Okay.
No.
Then another thing, they feel, you know what, it's a curse because you went to some place, you didn't do this thing, so some spiritual part has come inside you, so you are cursed. So these are the myth which is there, but in reality it's not a curse, it's a blessing. So it is again there in our Islam that Allah doesn't give you a burden which you can't carry.
True.
And then I think I would like to explain this one with one example. Again, it's from our religion aspect. There was a guy, he told his wife, he was having a conversation with his wife, and he was saying that I always sit, in the zikr of when Prophet used to give lectures, I'm always there. And Prophet said that, when there is no hardship, okay, so Allah doesn't love you. If you have not gone through the hardship, you are not favorite to Allah. Okay, now you see, the Prophet, he said with a lot of perspective. He went and he discussed with his wife. So his wife said that, okay, it's true. The people who go through the hardship, they are favorite to Allah. Okay, so he said, okay, let's go to our Prophet. We'll go and discuss with him. He went. They both went. And on the way, husband fell off. He got hurt.
Okay.
And it was really painful. So wife said, okay, fine, let's go back. Now I don't want to go. So he said, right now you were so stubborn. You said you want to go. And now you are saying, let's go back. I'm not understanding. He said, no, I wanted to go and ask for the divorce. That's why I was taking you there. But now I can see you already went through the hardship. So I know Allah loves you. So I'm okay now.
You are on the test.
Exactly. So now I know that, I'm safe, you are safe. Let's go back.
Okay.
So you can imagine that this small hardship, also how people used to think. But today's time, do we really think about that? Little burden comes, you immediately think, oh, you know what? I'm useless. I can't manage. And you must have heard from many people nowadays. It's too much on me.
Yeah.
It's too much. It's too much. What about our parents, our ancestors, who used to handle more than what we are handling?
Yeah. And even they used to have a lot of children.
Lot of children. This is again this is again another thing where they used to have 6-7 kids. And they used to balance wonderfully. There was no problem. In Deen also, in Dunya also.
Yeah.
But today, if we have 2 children also, we think, oh my God, I can't manage. So it's not a curse, it's a blessing. Let's take whatever Allah has granted us in a positive way.
Well, yeah,
we take
true.
it in a blessing and then we move on. And when you have that thoughts in your mind, Allah finds the way for you.
True. And He make them easier.
He make it easy.
Yeah.
We don't need to do anything. It just He finds. Allah sees what your intentions are.
Yeah, true.
How much patience you have. And what actually you are doing it. It's a ni'mah. We say Allah has given you, having a children is again another big blessing.
Yeah.
Whether the child is with neurodivergent or whether child is normal.
No.
Tell me one thing. Currently, you will find, leave about neurodivergent cases, the other children who are there, who are completely fine. They are not struggling.
They are.
They are also struggling.
Yeah.
I have come again, why I'm bringing this point. They also sit and they say, Mumtaz, you know what? I don't know how to deal with my child. Here, neurodivergent. Just imagine the children who are sin free, whose sins are not going to be counted at the day of judgment.
True.
So, what is big blessing? You want that one or you want this one? It's your evaluation.
Yeah.
Again, I'm bringing another hadith. There was a lady who went to Prophet. And I think she used to suffer from epilepsy.
Yeah.
I think you must be knowing this hadith. So she was going through her epilepsy. And she went to Prophet and she said, Prophet, can you please pray for me? That, this disease goes away from me.
Yeah.
So Prophet said, no problem. But you have 2 options. Either I pray for you, okay?
The disease goes away.
Or
Okay.
either you stay with it and you go to Jannah.
Yeah, you observe sabr.
Sabr,
Yeah.
your patience.
Yeah.
So definitely that lady say, no, let it be with this one. But then again she asked, okay, fine. I don't want my disease to go away. But whenever I'm getting epilepsy, I become unconscious. So I don't know what is happening with my body. And my clothes are not in my control. So that haya, that shame,
Yeah.
if you can help me with that, it's inshallah care. So this is the way this thing happens.
Yeah.
So it's more about accept. When you accept, Allah helps you, Allah finds the way for you.
Yeah, true.
But if you are in denial,
Yeah.
this is another myth which we have. In the society which we are living, when they know this child has a difficulty in anything, they believe that no, my child is completely fine and that child should remain inside the house. They should not be outside the society.
Yeah, they shouldn't mingle with others.
And it's really painful. It's really because they don't know how to manage.
Yeah.
They don't know how to balance. And because of that, they feel it's better to stay at home. And sometimes they themselves stop social interaction. Parents themselves, they do this. They said, I think so it's better I also stay at home. And this is again another thing where they feel, again I'm emphasizing more about the curse. They feel it is a curse, I should not take him out.
Yeah, subhanallah.
Alhamdulillah. So this is another one. There is another myth which we have in society. My parenting is not okay.
Yeah. That's why Allah gave me this.
And then again, parenting is not. Tell me, all people are different. All human beings are different. And dealing with that human being is going to be different.
Yeah.
The way I deal with you, I can't deal the same way.
Yeah.
So parenting is also a journey. It's an experience. It can't be the same for everybody. So this is the thing which we need to work on.
Okay. Is autism a mental illness or it is just a neurodevelopment condition?
Okay, autism is a neurodevelopmental condition. It is not a disease. It is something which you have to be with it. Let me use that word. But we don't say you can't manage them.
So it's manageable.
It is manageable.
Okay.
It is manageable. And if you use a right approach.
Okay.
So it is manageable. And the way there are so many cases where you will find those people, they are working independently, they are leading their life independently, they are getting married also. Let me use that word too. You will find children with neurodivergent, mashallah, they are so good in memorization of Quran.
Yeah.
They are. I know one child, that child is leading Salah.
MashaAllah.
So we have such. So again, this is a condition. It's not a disease. So it is something which is manageable.
Okay. So it's how the parent coaches the child.
Exactly. How they coaches, how they look at it, and at the same time, how they deal with it. How they deal with it. Dealing with neurodivergent is not only by the experts.
Okay.
It is also by the parents and the people who are living
around. Okay.
The way I said, when you take these children, the parents feel it is a shame to take these kids outside. The myth which we spoke about. Now, why it is a shame? Because the parents have not accepted. And they feel, if my child will behave like this, everybody is going to look at it. What about Allah? Allah is looking at your efforts.
Yeah.
You took the child outside. So you need help from who?
From Allah.
Help from society or from Allah?
From Allah.
So this is the approach when parents will change. This is not something which is big challenging. Anybody can handle, anybody can deal with it.
Because if you ask help from Allah, Allah will easy the way. Yeah. Because those who are around you can help you.
Can help you.
Yeah.
I totally agree with you. And it's true. Because you see, Allah sees your niyyah. Allah sees your patience.
Yeah.
Allah is seeing, this person is really putting efforts. So why not? Now, efforts are going to be for how many? It's a test.
Yeah.
whether you have that sabr or not.
Yeah, true.
We can't expect that, you know what, I have done the efforts for 1 year, or next year I should have a miracle. It's a test, it's a process.
Okay, that's true. And from an Islamic perspective, how should we view children with autism?
Okay, I generally always tell my parents and everybody, don't treat them or don't look at them as they are children with some condition. Treat them like a normal child.
Normal child, yeah.
When you will start thinking that way, your approach will change. Your strategies will change. Because here again we have this thing, you know, whenever you have child with neurodivergent or cognitive impairment, they use the word maskini.
Maskini mgane mgonjwa, maskini ana hivi, maskini. Yani there's that sympathy.
Very true. Sympathy. Now you took a very right word, sympathy. We like to sympathize. Have you ever think of empathize? Did you go forward and you tell that parent, you know what? Why don't we do something which can help your child to be better?
Yeah.
Instead of saying, you know, maskini. And this is very common again here.
Yeah, true.
And then, you know, if parents are trying to be a bit strict with them or trying to be disciplined, again, you know, people in the society, they say, you know what? He has this problem. Don't be like this.
True.
It's like, you know, why are you being so cruel? Yeah, why are you being so harsh?
Wamchapa maskini mwenye mgonjwa. Maskini. And I think those terms can make the kid be more like, okay, sasa ndo mgonjwa swa. Manake hana pia tabia.
Exactly. And this is again another thing. Now, you know, Maryam, I like about you, you're catching the right concept, right points. Huh? Because the child is understanding. The children, this neurodivergent, they understand.
True.
It's not like they are not understanding. They understand what you talk and they can read your body language very well.
Very well. Okay.
So when they say, like for example, if you and me, we are there and there is a child, and let's say if I tell you, you know, maskini, please don't do it. The child is seeing, the child will take it as a granted and he knows how to take it away. This is something very, very true. And this is what is happening in our society.
Yeah.
And we have to come out from that maskini zone. That no one is maskini. It is given by Allah. And Allah will cure.
Kabisa.
And do you agree with me that people say, you know, saying maskini? I don't know. It's like, you know, even the beggars who are there on the street, some people feel pity for them.
Yeah.
What our Islam says on this? Our Islam says, you know, I have given. Don't say, oh, you know what, I feel bad for that one. Who are we to feel bad? If you can do something for them,
just do it, yeah.
You get it? But don't go there, oh, you know what, why Allah has given to them. Why it is happening? If, as a person,
it will be like questioning Allah.
Exactly. And we do a lot.
Yeah, we do a lot.
Consciously or unconsciously. So even like in a layman, like let's say you're working, you're a mother, you have a family. There are so many phases. If you sit down and you write the whole day evaluation, you'll find out in our society, we do questions unknowingly.
Yeah.
So this is what is happening. So these children are also helped and treatable.
Okay.
Yes.
So some parents ask, why has Allah chosen my child for these tests? How do you respond from both a psychological and Islamic perspective?
I always say Allah chose you because you are lucky. You are really lucky. Tell me, when you are raising a child with neurodiversion or autism, is it easy? Easy than raising a child who are normal? Compare. Is it easy or hard?
I think a normal kid is more harder. Because, you know, yani wako like wanafanya mambo ambayo wao wenyewe wanafahamu, wanajua wanafanya nini. But unlike the autism child, it's how you want you want the child to be.
Exactly. The way we have a born baby, they don't know what to do. You can mold them the way you want.
You want it, yeah.
But like, let's say when the child reaches to the teenage, now if you try to work on it, nothing will happen.
Yeah, true.
Because in our deen, again, it is there. Whatever implementation or whatever changes you want to bring in the child, you can do it up to the age of 7. And it is the same thing which is applicable for the autism spectrum disorder.
Yeah.
Now this is again, the science is proving right now, but it is there in our Quran from years
Yeah,
and years.
true.
That if you want your child to be manageable, whether it is autism spectrum or the mainstream, if you want your child to be manageable, invest your maximum time in this duration, up to the 7 years. And then at the same time, raising these children. The way you said, whether you raise a normal children or this spectrum, the normal is more hard.
Yeah.
Okay. Now in spectrum, why we find it hard? Because we are not aware. We don't know what to do.
And I think we always are in denial.
Denial. She will be fine. There is no use.
Hana nini, wacha tuangalie hao wengine, mwacheni tu. Ndo hapo maskini, mwateni hapo. Tuangalie hao wengine watatufaidisha. Naye matibabu mara sijui nini, atafaidisha chochote.
This is the thing you're reminding me about one parent. The child is grown up. She is around 30-40 years.
Mashallah.
With the spectrum. I agree, okay. Now the person is 30-40. It's like majority of the life is finished. Now they couldn't do anything because they didn't have any awareness. They didn't know what to do, how to work on it. So they didn't go. Now the time when the meeting happened and consultation was going on, and then we spoke because the child is violent.
Okay.
Now you see, the behaviors are not managed before years. Now the child doesn't know how to take out those emotions.
She doesn't know how to control herself. Okay.
Like for example, today, if you're tired, what you will do?
You relax.
Physically tired, you will go relax.
Relax or lie down. That's it.
If you're thirsty, you will drink water.
Yeah.
Or like for example, you feel like having something nice. Maybe you will go and eat nyama choma or chips and chicken.
Or take ice cream, anything.
Coffee,
Yeah.
Now how you know? Because you understand. You go, you speak, and believe. Now these people are not doing it because they are delayed in speech. There is no training is given to them. They don't know how to manage their emotions. So they are just being, dump. You can use that word, or they are just being thrown. Because the parents doesn't have the awareness. It's not their fault, but they were not being given a right direction.
Okay.
So they think these children, whatever you do, it's a wastage of time.
Yeah.
And it's not going to help them. But we need to work on this population to make them to lead their life in a happier way. Now these people, we know, even if you try to train them or work on them, it will take 2 years, 3 years, whatever. With something we call vocational training.
Okay.
You get me? So you can train these children by doing something small tasks in the house. It can make them to feel good. For example, the way I told you, they are very sensitive to the sensory stimuli. Okay, they are sensitive to the voice, light, and all. They are very much texture based also.
Okay.
When you touch this, like here, and this texture, if you see,
the difference,
rough,
smooth, yeah.
When you touch smooth, you feel nice. Here again, you feel different. Now this feeling, when you give this kind of a children, it gives them a satisfaction inside.
Okay.
So for example, the house chores, like cleaning the table, simple task. You don't need to go outside.
Okay.
Like arranging the things, when they see, they like to arrange. This is again another typical characteristic for these children. They like to keep things in sequence. So use that strength and give them that task.
Yeah.
So at least they feel they are also responsible and important in the house and in the society.
Okay.
They are very good in coloring. You can make an art piece for them and display. So whenever the child is passing, they see, they feel motivated.
Yeah.
Remember, their understanding is good. Children with spectrum, you will find their intelligence are very nice. They are very, we call genius category sometimes. So they have some strength which you need to find out.
Okay.
So these children should be viewed as a normal human being rather than categorize them and keep them in the corner just to be there. And we have many people. We have.
Okay.
I really feel bad for them sometimes. That's why sometimes you go out of the way.
Yeah.
Recently again another person had come to me, and when he was talking with me, he said, Mumtaz, there is no problem. I wanted to come and bring my child, but I have money issue.
Yeah. And the therapies, seeing the doctor, maybe the schooling of their schooling, do they use medicine?
Okay, depend on the case wise.
Okay.
What is the severity and all.
Maybe
But
the
they do use
treatment,
medicine.
the
It's a lot.
Yeah, it's a lot.
Test itself, like they go for MRI, EEG, blood test. How much it is?
Yeah, subhan.
It's like you need to have 20,000-30,000 in your pocket.
Yeah.
So like when this person told me, I said, you know what? Don't worry. We see how we can help each other. So alhamdulillah, inshallah, khair. Hope for the best. So this is the way these children are. So we have to look at them and we have to see how we can support them.
Okay. And I think a lot of awareness is needed for the community to know about this condition.
Exactly. I don't know whether you're aware, in UK and European countries, they have started a support groups
Okay.
in mosque.
Mashallah.
Mashallah, I was so happy because you need to have those kind of a support groups in our society. Now, when we say support group, so people feel, I'm not alone.
Yeah.
There was a Maulana, Ustad, who was giving a lecture in a mosque. And he was just briefing that, in the mosque when I was sitting, and I think he was talking about the same topic, autism spectrum. He said, when I asked that in this mosque, how many people are there who has autism spectrum children? He was surprised. He was saying that majority of the kids in the mosque, they were having autism spectrum children. And he again, then I think he made some kind of a booklet for them and some kind of an awareness they did in mosque. And I think mosque is the right place.
Right place. Exactly. Subhanallah. What emotional challenges do parents typically face after learning that their child has autism?
They cry.
That's cute.
They cry.
Okay.
I met a parent whose child was 18 months.
18
months.
Mm-hmm.
And when I was communicating, he already knew that this is autism. But he was not explaining. He was talking about, she has a speech problem, she has this problem and all this thing. And I realized that, somewhere he knows and he wants somebody to ask. And when I asked, what do you think? What exactly the challenge she has? He said, I feel he has autism. She has autism. I said, okay then. And I'm worried about her future. I saw the mother was still strong, but the guy, he started crying.
The dad?
The father. He cried. I didn't stop him. I said, you're worried about future. I said, yeah, I'm worried about her future. She's a girl. And I don't know what I'll do. I don't know how to manage. And I think he poured his heart out. He said, I don't have anybody in my family. I don't know why I got this child. So it was a time, when he wanted to remove his emotions.
Yeah.
And, more than a child, we believe that we need to work on parents.
True.
So I just listened to him and I said, fine, now we have or we don't have. That decision will come later on. But are you there to help each other? Then we can go ahead.
Yeah.
He said, I'll do anything. I will do anything.
To make sure my child...
It's fine.
Yeah.
So this is the parents. So first thing, they go in a depression. Second thing, you will find marital conflict.
Yeah.
That is another problem. So couple also go through a lot.
Sure.
Third thing is sometimes you find them, they get into drugs also. The drugs, because they feel when we take any kind of a drugs, we are a different person.
Yeah.
So we are not having any stress.
I can't think about it.
Now, why it is happening? Because they parent themselves, they don't have any social life. Because 24 hours somebody has to be with them.
Yeah, true.
Sorry.
Mtazamaji, tunaendelea na kipindi Ijue Afya Yako, na kumbuka siku hii ya leo tunazungumzia kuhusiana na hao watoto wenye maradhi ya autism. Topic ni an Islamic psychological perspective on autism, na tumesema kuwa autism ni tawahudi ambayo ni kama vile mwenye daktari alivyosema, ni it's a condition. Si eti kuwa ni maradhi, hapana. Ni hali ambayo inaweza kuwa managed, ama inaweza kuwa managed, tunasemaje Kiswahili? Yaani inaweza kushughulikiwa na mtoto akawa ni mwenye kuishi na kuendeleza maisha yake kama kawaida. Na daktari.
Yes. Sorry.
It's okay.
Yeah. So this case, the way I was explaining you, children have one condition, but when it comes to the parents, I think they have a lot of emotional toil.
Yeah.
And at the same time, there are a lot of stigma which comes from the society.
Yeah. True.
And that also gives them another pressure. And then already in today's time, which we are living, financial issue is another problem.
Yeah.
So that is another stress which is top on. So I feel the parents also goes through a lot. Depression, one I said, drug addict, you find them to get into this thing. Even like, the couple conflict and all. So you will find these people, and I have come across people where, they go to extreme, we call it psychosis. So they get into that situation too.
Subhanallah.
Sometimes they run away from the situation. They don't want it. And by the way, this is again another thing. I met one family where it was long time, because inside the house, mother and father. Okay, so this couple, mother will not leave the child anymore.
Yeah.
But I think
very rare.
Very rare. So I think the father went, and he went one day, and he didn't come back.
Never to return.
Never to return. So we have such people in society.
Yeah.
And cases of autism right now, if you see, like out of 10, 5 people minimum has autism today.
Yeah, subhanallah.
And in Mombasa, the rates are going high. And I don't know, there are many who are still in the house. They have not come out.
Yeah, true.
There is no awareness. So that is again another weakness which we have. And it's really true that there are many people who have this condition, and they are still kept at home. They are not being sent in school. They are not sent being in madrasa. They are not being given any kind of extra, curricular activities. For example, the one which is our sunnah is swimming.
Yeah.
How many of we are training our children for the swimming? Horse riding.
Yeah.
We don't need to go anywhere. Just follow our Islamic perspective. Things are very easy.
Yeah, true. And we have Indian Ocean here.
And Mombasa is very good in swimming.
Yeah. No, any amount of cost is needed.
No, you don't need. You just take the ends. In fact, ocean is much better than the swimming pool.
The swimming pool, yeah. And how can we maintain a healthy family, or maybe a couple, to maintain their marriage while raising an autism child?
Okay, now here, the way I said they go in depression, they go into this thing. Let me today now focus on the parents, like the couples who are having autistic kids. Here again, let me explain you with the case study. So this parent, both the parents are working, and they have 2 autistic children.
Subhanallah.
2 autistic children. And they are around 4 to 5 years, beginning of the year. And in Mombasa at least we are blessed that we have house helpers are
Yeah.
there. Can help you for house chores and everything. Now what is happening? This couple, I met them. They were saying, oh, we wanted to start therapy, we wanted to do this. I said, fine, there is no problem. When I realized, I said, I can't start therapies unless you guys are organized, you guys are sorted, your home environment is fine. Then if you start therapy, you will see the results. Because children with the spectrum, you will find they like organization. And they see a lot of distraction around you. Even if they try to organize or discipline their life, it won't work. It won't work. If the house is a mess, and if you try to work on the child, it won't work. And this is something which we think, oh no, it doesn't matter. It matters. It matters a lot. Because these children, if the room is with a lot of things, they become hyper, they become restless. Yes. They are very sensitive and they are perfectionist.
Where?
It's like, if your house is clean and organized, if you work on these children, it works. So, of course, the time management, that is one aspect which these parents needs to learn. Again, the discipline. This is again a part of our Islam. Our Deen said that have 5 times salah, keep your things clean. What is Islam? Is to keep yourself clean.
Clean, yeah.
So, clean is not only about yourself, about you keeping your house also.
The surrounding.
So, the couple needs to have organization of time. They need to have organized cleanliness. Another aspect which the couples can do is like once in a week, or if not possible once in a week, once in a month, when the child goes to school or anything, or wherever the child is, they need to spend time together.
With the child?
No, themselves.
Okay.
Themselves. Couple, they don't spend time with each other nowadays.
Yeah. People are very busy.
Very busy. And you see, we say the Prime Minister or the one who are sitting in a high position, they also have 24 hours, right?
Yeah.
But still they have a life for family, they have a life for themselves, and they're enjoying. And why don't we don't have time? And they are earning more than us. And still, we say, oh, we don't have time.
Yeah.
But you see, it's more about the time management.
Yeah.
How you're managing the time. We wake up early in the morning Fajr for Salah, 5:30, right?
Yeah.
We pray Salah, then we pray Quran. Everyone has the routine. How fast you are, how accurate you are, that matters.
Yeah.
So your speed of working is not going to be the same the way you were before marriage. You need to change. Now you are not a child, or you are not a daughter or sister, you are wife.
Your wife
Now,
and you're a mother.
Exactly. So you have dual role. So when the role is increasing, your capacity also has to increase.
To increase, true.
Then again, the follow-up on health. They don't take care of health. Parents, they eat anything, whatever is available. Now, this eating is another different concept altogether. The way our lifestyle right now. Every Saturday, where we go? Every Saturday in Mombasa, there is outing. You will find all the restaurants are full of.
Yeah.
And we are sitting there to eat what? Junk.
Junk. Even at the seashores. Junk is everywhere. Yeah.
So our lifestyle, we need to change. So quality time, if couples, they spend together, a lot of problem can be solved.
Yeah.
When I'm saying quality time, it means that they have to sit together to talk about themselves. Not to discuss about I have this problem, that problem. Before marriage, we were talking about all these things. No. When you are just getting engaged, we talk. We are in a different world. We are in a different world. That time it's you and me.
Yeah.
It. Now it's not you and me.
You and me against the world.
And now we will discuss about, like, you know what? This one she did this. This one he did this. That's the discussion which is happening among the couples also.
Yeah, true.
So we don't talk about ourselves. Or our family. Our discussion is going about somebody else. So what we are doing? Negative energy.
Yeah.
Or we call fitna. Or,
backbiting.
Backbiting. Which is not allowed.
Yeah.
So everything is there in Islam. By the way, backbiting is not only done by women nowadays.
Even men.
Men are also there.
And they are taking the rank. Okay. What are the early signs that a parent should never ignore?
Yeah. Okay. The very important thing, breastfeeding. If your child is not breastfeeding, that is one aspect.
Okay.
Second one is delayed in milestone. If you find anything like walking, crawling, sitting, not responding to your voice, okay, when you're calling, the child is not responding, and when you make them to sit with other children, they run away, they stay in one corner, they play by themselves, and delayed in speech.
Okay.
Again, the children with neurodivergent, the prominent feature which you see is delayed in speech. So that is something which is very common with these children. So this sign should not be ignorant. And at the same time, if the child changes, because there are children you will find the development, everything is okay up to the age of 2 years or something, but all of a sudden they change. Now those ones are the sign. Maybe the child was talking, but you will find now they are not talking. They stop talking, they stop responding. You need to know. And any accident, medical thing has happened. Like let's say child has fallen from the swing or like from the height and got hurt in the brain, or any kind of emergency which had made the child to go to the hospital to be admitted, it is a sign. There is another sign which I can say you can identify in school. We call steaming in our clinical language. At the same time, these children, you find them, they try to rub their private part. So again, sometimes parents think, what, she's just playing. And school can identify faster than parents also. So you will find them, they are steaming. You get me? And like rocking back and forth. These are all like, the symptoms which you can identify. So identification of the problems in early age has to be done before 2 years. The way I told you, the walking, crawling, even eye-to-eye contact. Because when the child turns 4 to 5 months and we try to, make them laugh or anything, they look it in your eyes. Yes. So if you see the child is not looking in your eyes or not responding to your voice, when you smile in front of them, they smile.
They smile back. Yeah.
Yes. Those are the features which you need to identify in these children early age.
Okay. And how can we improve their communication and social skill?
Okay. At home or in general?
In general.
In general, okay. Again, it matters what age first, what level of communication or speech problem they have. Like let's say in majority of the spectrum cases, you will find they have speech. Speech is there, but they are not able to communicate. You will find that, you are singing with them a nursery rhyme for 1 month. They are not singing that time. But after 2 months, you will say all of a sudden the child is singing. Yes. So you will find the speech is there, the voice is okay, they can say the sound and everything, but they are not able to respond and communication. You get me? So these are the signs which they need to be alert on. So when it comes to the improvement, one improvement which can be done at home, family involvement. Nowadays, we give them a TV to talk. I come across again many cases young age where parents leave the children for screen whole day. Whole day.
They do keep them busy, but I think they usually make them dumb.
Yeah. They think, they are learning. Now what happened, for example, right now, you and me, we are sitting here, I'm talking, you are responding. You are responding in terms of verbal and at the same time with your body language. So I know I'm getting a reply. Now when you leave me on the screen is not replying me. So I'm not learning how to communicate. So this is something which parents needs to do. That's why we say the group play and all. So family need to sit with them, play together, getting involved together. That is one strategy which parents can use it. Apart from there are some food items also come which can help them. So this is something home management, if you say. And apart from there, to improve the speech or communication, seek for a help if there is a need. Go and look for the experts who can help you to identify. there are team which works for these children.
Okay.
It's a teamwork, by the way.
Yeah.
When we say spectrum, it's not one man show. It's a teamwork. So they need to have a team who works together. And the team which are there is, of course, clinical psychologist.
Psychologist.
Yes. Then we have occupational therapist. We have even psychiatrist also play a role. Sometimes you need a neurologist also. Speech therapist. Okay. And OT, speech. Yeah. These are the main. And yes, teachers.
Yeah, and teachers.
Teachers, they play a big role.
And the parents themselves.
Parents are the biggest role. You know, to involve the parents, sometimes you need to have a coffee morning with them.
Yeah.
That can help them to engage.
True.
So I think this team need to be involved to improve the speech. And you need to have early identification. In speech or communication, there are levels.
Yeah.
So which level we need to work on for the child. Yeah. For example, some children, they are good in receptive language, but expressive language, they are not good. So now this is again different category. So it's very important for us to have correct diagnosis. Majority of us, we fail because there is no correct diagnosis. The child is done trial and error, error. So in fact, I will request even the schools, if they have any sign, if they find, okay, this is something which is alarm, encourage the parents to go and see any specialist. Because you will get such thing from the school only.
Yeah. Because they do spend a lot of time with them.
Yeah. And they understand because in the classroom setting, they're with other children.
Yeah.
And they can observe a lot. You can observe the child's behavior when the child is with another child. And then there are a lot of tasks which they do together. So in school setting, they can know a lot. So I think this is the way the speech communication, even the school also play a role in terms of improving the speech for these children.
Okay.
So I think this is the way we need to work on to improve the speech and communication.
Okay. Many people focus on the challenges of the autism child. What strengths and unique abilities do they have? Individual.
Okay. Here, like when it comes to the spectrum, we always see the weakness. We never see what strength there, because we believe that that the child is with spectrum means they can't do anything.
Good. Anything good.
Good.
Yeah.
I think that is the right term. Anything good they can't do. So generally with these children, they have a unique ability. They are very creative. And the way I told you before, there was a child who is very good in reciting Quran.
Yeah.
And he's leading Salah.
Yeah.
I have another one, like, the child who is mashallah, too good in spellings.
Mashallah.
So these children, they have unique abilities. Then again, they are good in mathematics. It's more about how you can find out. So there are children who are very good in mathematics, even the normal children. So again, the spectrum kids, you will find their intellectual functioning is above average. Majority of spectrum children, their intellectual functioning is high.
Okay.
They are not low. Now this is the difference which parents needs to understand. Now spectrum and somebody who is slow in learning. Now, this is again another terminology. Slow learners and then again the people who have intellectual impairment. These are two different terms. So parents needs to differentiate first.
For sure.
Is it spectrum or is it the impairment of intellectual functioning?
Okay.
Spectrum is a condition where the child is not able to function freely because of his other challenges, not because of his intelligence. He has the ability to learn from environment. He has the ability to develop the communication skill. He has the ability to learn academics also.
Okay.
So it's not like that children with spectrum, they can't do. So it's very important for us to understand their ability and their strength. Because instead of nurturing weakness, let's nurture the strength.
Yeah.
This is again, we are going back to our Islam. When you are meeting any person, okay, even somebody has done a sin, you don't curse the person, but you curse the sin.
Yeah.
You get me?
Yeah.
So same way, when you are meeting any children with the neurodivergent, rather than looking at the weakness, why don't we nurture the strength? So when the strength goes up, the weakness
goes down. Yeah. Okay. And can individual with autism succeed academically, socially, and professionally?
Okay, children with spectrum, if they are being given a proper training and a proper management program, they do improve academically. There are many children who are going as per their age. For example, somebody is in grade 4, they need to know how to read and write, right? And at the same time, they are able to solve. So if there is a proper training and management is done, they can go with their level.
Okay.
And mainly, the children need more one-to-one program. Okay, so even they can study in a mainstream. It's not necessary they can't. Now there is a lot of facilities which majority of the schools are providing. So we call inclusion program. So these children with neurodivergent, they can do academically well with a proper strategy and management.
Okay. Talking about professionalism, that's an autism a child. I remember I talked about the movie, the doctor.
The doctor, the TV series
Yeah.
on Netflix.
Yeah.
Yes.
I didn't know about a child with autism can be a doctor, specifically a surgeon,
which is more challenging.
I was like, okay, this can happen, or it's
possible.
just a series.
Okay, there is a possibility. That's why I said the spectrum with the intellectual functioning. These are two things. Now, the way I gave you the example, the child who is very good in mathematics.
Yeah.
And maths is the hard subject for the kids. And spellings, again.
Yeah.
If you give him any spelling, he can just tell you. He will tell you perfect spelling.
Okay.
If you will send this boy for the competition, he will definitely win and come. So, these children, intellectually, they are fine. It's just about their condition, the way I explained you. Professionally, the way you said about that series of the doctor. Okay, now remember in the beginning I told you there are categories: mild, moderate, severe, profound. So it's very important that spectrum, if they are in spectrum, which category they are in.
Yeah.
And the way that series which is there for the doctor, it seems he is more into mild category.
Yeah.
And mild category, they can operate. And you must have seen in that series, the eye contact is a big problem for him.
Yeah, true.
Yeah, but he's very sharp.
Sharp, yeah.
And you must have seen in that series, at time he was responding, but bit late. So that is a sign of spectrums.
Oh.
Yeah, so this child also been given a lot of effective training. I think they were showing even their childhood history, where the child was being neglected from the parents, no support and all this thing. But there was somebody who believed in him and worked on him. And that's why the guy reached to this level.
Yeah.
So I think this is a very good example for us. Even currently, there is, again I'm going back to Mumbai. It's one of the celebrity in Mumbai who have opened a restaurant.
Okay.
Where they have all special children.
Ah.
They are the one who are running the organization.
Mashallah.
So I think this is again a community work.
Yeah.
We need to search the employment for these children. There are children who are not good in academic. Now government has passed a law where they provide the facility of opening some small business for them.
Yeah.
You get? So when they're opening a small business, are we training them? So we need to train these people. When these children or these people, they get a proper training, they can also lead independent life.
True.
So like simple tasks like clerical job or receptionist work or graphic designing. I have so many examples, okay, where you will find these people, they are working. Even in Mombasa we have. Just only those people have not come out.
Yeah.
You get me?
Yeah.
So it's like, these adults also, if parents also take it seriously, and if something can be done for this parent, trust me, miracle is possible. It's from Allah. The way in the beginning we said, it's your niyyah, your intention. If you do it with honesty, Allah will help you. Allah will find the way for you.
Yeah, true. So, lastly, what advice will you give to community? First of all, to parents, those who have received an autism diagnosis of their child, and to the community at large.
Okay, community. I really need a big help from the community. When I'm saying community, the one thing which I said in the mosque, let's have a lot of support groups for these people. And apart from the support group, they should come up with some programs which can help this human being not to be left out, but make them feel they're also important and valued member in the society.
Yeah.
And the third thing, there is one thing which I feel is a challenge, or we have professionals. What they are doing, how they are doing, they need a proper training. They need a lot of exposure. Let's stop doing trial and error. Let's have a proper diagnosis. So for the community, I wanted us to we come together and we prepare something which can help them to be independent. I gave a lot of examples. The way I said, in Mumbai, there are people who have employment.
Yeah.
Okay, then another thing which I told you, in European countries, they're making a lot of support groups.
Through mosques.
Yes, through mosques. And at the same time, we can have some women program or anything.
Yeah.
Not like one time. We have ongoing development program for them, even for the men. Because nowadays, everybody focus only on women and men are left alone. I think we should have some kind of a program for the men, because things will begin from them, not from the child.
True.
If they are mentally sorted or they are mentally healthy, the child will be fine.
True.
That is what a message I wanted to give it to community. When it comes to the parents, I will say that diagnosis. Let's understand what condition or what challenge the child has. Find out a proper professional, get the diagnosis. Another thing, the second aspect is accept it. There is no problem.
Yeah.
Accept it and move on. Then seek for a proper help if there is a needed. That is also there in our Islam. That deen is there, dua is there. But along with dua, you work on this also.
Yeah, true.
Go and seek for a help and support your child. There is no shame.
True.
And then the major thing, the lifestyle, we need to change.
Okay.
And the diet. Are we living a simple life nowadays?
No.
We all have a luxurious life. We all want something. And our Prophet said, live in simplicity. Our Prophet said, have discipline. We are praying 5 times salah. It's true. But apart from that, do you have discipline in your home?
No.
Discipline doesn't mean you shout, strict, do this, do that. No, discipline in your life.
Yeah.
And then food. With children with spectrum, they do have a challenge with the diet.
No.
And health issue like constipation. So we need to work on the diet. So follow what our Prophet said. You don't need to go outside.
We need to eat healthy.
So sugar, preservatives, white flour, reduce it. And you see the change in your child's behavior.
Okay.
So I think this is the message which I would like to give to the parents, guardian, caretaker. And last, not the least but last, I wanted to say, when you have a niyyah and if you are honest from your heart, Allah will help you.
Exactly.
That's the way I want to end. Be honest what you do. Don't do it because you want to please this one and don't do it. Think only that you want to please Allah. And these children are blessing. So whom you should please is Allah.
True.
Take them as a blessing and preserve that blessing and nurture it, and you see the shower will be there from Allah.
Amen.
Ameen, ameen.
Amen. Shukran, Dr. Mumtaz, for coming.
Thank you so much.
And for today. I really learned a lot. And I hope our viewers have also learned a lot from this program today.
Inshallah, inshallah. I'm very happy to be a part of this program. And if anybody want any assistance, any kind of a guideline, they can reach me, no problem. And at the same time, whatever I can do in my capacity, inshallah, I'll try my level best.
Okay.
That is what I can say. And let's work together as a team. And we support each other.
Yeah.
And we all grow together.
Amen.
Thank you so much.
Inshallah. Shukran sana.
Thank you so much.
Shukran mtazamaji kwa kuwa nami kuanzia mwanzo. I hope elimika kwa yale ambayo tumeweza kuyazungumzia siku hii leo. Tumezungumza mengi sana kuhusiana na watoto wa autism, na mengi ameyazungumza daktari. Tuweze kubali kuhusiana na hali hii ambayo Allah subhanahu wa ta'ala ametupa. Ikiwa uko na umepata mtoto ambaye ako na changamoto hii ya autism, basi usibabaike, usikate tamaa, usiwe na wasiwasi. Madamu Allah subhanahu wa ta'ala amekupa mtihani kama huu, basi yajua waweza. Kwa hiyo tuwe ni wenye mtarajilia mema Allah subhanahu wa ta'ala. Maana amesema tumdhanie mema Allah subhanahu wa ta'ala, na yeye atatupatia mema. Kwa hivyo ikiwa kuwa ni mwenye kushukuru kwa kile ambacho Allah subhanahu wa ta'ala atakupa, basi na yeye atakuzidishia na atakupatia njia, itafanywa kuwa rahisi kuweza kukabiliana na lolote ambalo amekupatia yeye mwenyewe. Maana yeye amekupa na yeye ndo mwenye kuondoa. Sina la ziada mtazamaji. Mimi na wewe inshallah ndani ya kipindi kama hiki tukutane tena Jumamosi ijayo panapo uhai na uzima. Jina langu ni Maryam Juma na kutakia wakati mwema. Maasalam. Na Dr. Mumtaz amesema ikiwa una lolote kuhusiana na hii mada yetu ambayo tumeweza kuizungumzia siku hii ya leo, yuko na kliniki yake, unaweza kumtafuta mkazungumza na mkaona vipi mnaweza kusaidiana ili kuhakikisha kuwa hawa watoto jamani tunawapatia mwelekeo ulio mzuri, na ili wawe na future ambayo inakuwa ni nzuri zaidi. Maasalam. Nazidi kutegea Al Ihsan TV.
رب علمنا الذي ينفعنا، رب فقهنا وفقه أهلنا وقرابات لنا في ديننا. ربنا